Hi guys, it's Amanda again. Just going to take a look at the respiratory system with my patient Stephanie. How are you feeling today?
Good.
And looking at her, I can see that her posture is upright. She's in no apparent distress. In breathing, she's having no nasal flaring. Her skin is warm and dry. I want to take a look at your nail angle. If you can place your two fingers together. And looking at them, they form a 160-degree angle. In checking someone's rate of breathing, it's usually checked for a full minute. For the sake of this, we're just going to take a quick look at her. So her breathing is equal. Next, I'm going to have you turn around for me. Just going to move your hair to the side. I'm going to palpate your back for any tenderness. Do you have any pain anywhere?
No.
Next, I'm going to take a look at thoracic expansion. So I'm going to place my two hands here. I want you to take a deep breath in and out. Good. So you want to check for equal movement, in which she has. So next, we're going to check for tactile firmitus. So I'm going to use the palm of my hands, and every time that you feel my hand, I want you to say 99.
99, 99, 99, 99, 99, 99, 99.
Good. Next, we're going to practice percussion. So I want you to give yourself a nice big hug. And I'm going to tap gently on your back. So here we're looking for resonance, and you can tell that the lungs are resonant throughout, and the lower you get to the bases, they're pretty dull, which is normal. Next, we're going to take a look at diaphragmatic excursion. So this checks the amount of air that you take in and out. So first, I'm going to have you take a deep breath in, and you're going to let it all the way out. You're going to exhale fully and hold that exhale for me, okay?
Okay.
All right. And now I'm going to have you take a deep breath in and hold it. So I'm just going to measure these. So the first tape on here measures the full exhalation. And the second piece that I have here is the beginning of the full inhalation. So a normal measurement uses about 4 centimeters. So that's within normal limits. Next, we're going to auscultate the lung fields. So there's posterior, anterior, and lateral. For the sake of this, we're just going to take a look at the posterior. So I'm just going to have you take some nice deep breaths. Breathe normally for me. Good. Next, we're going to take a look at the cardiovascular system. We have the aortic, pulmonic, herbs, tricuspid, mitral, and apical. So first I want to say, we want to have someone turn their head to the left side. To check for JVD distension, normally you would have the patient in a supine position with their head elevated about 45 degrees. You would look in this area, observing the neck for any pulsation. For the sake of this, I'm going to have her sit here. We don't see any distension, we don't see any pulsations. So our JVD is not elevated, which is great. Next, I'm going to take a listen. order to find S1 and S2, to see where you hear them the loudest, S2 is heard louder up in the aortic and the pulmonic region, and S1 is heard louder in the tricuspid and the mitral region. S3 and S4 are low-pitched sounds. Using the bell of the stethoscope is easier to hear these. And I didn't hear either S3 or S4. Next, to check for murmurs in the aortic or pulmonic region, I'm going to have you lean forward. This allows these murmurs to maxify their intensity. I'm also going to use the bell and the diaphragm side of the stethoscope. And next, I'm going to have you lie down on your left side, so you can place your head at this end. We're going to listen in the tricuspid area for S3 and S4 using the bell as well as the diaphragm again. Just move your arm for me. Good. Again, no murmurs this way either. And lastly, we're going to look at the peripheral vascular system. Just going to move the sleeve up on your shirt. And do you mind if I just if we roll this one up a little bit? Sure. Good. All right. So looking at her arms, her skin is warm, dry, and intact. Normal hair distribution all the way down to her fingers. Just gonna see this leg. You shave?
Yeah.
Okay. So her hair on her legs are shaved. She does have some hair on her toes, which means that she has great circulation. There's no edema. Just gonna take a look at you. Great. Yeah. Cap refill is brisk. Skin turgor is intact. Next, we're going to take a look at a couple of the pulses. Okay, so here we have the temporal. It's normal, +2. Working our way down to the carotid. +2. Just going to hold your arm up, okay? And check for the brachial. +2. Radial. +2. Ulnar. +2. I'm just going to have you lie down so I can take a look behind here. So your popliteal is behind your knee. A little bit hard to get up with your pants. You can still palpate it. It's +2. Working our way down, dorsalis pedis. +2. Posterior tibial. +2.